brightest of Jacksonville. We do that by reminding you if you're looking for something to do or for someone to help, it is always better to look local. On today's show, we're going to focus on new research for Alzheimer's disease. The Jacksonville Center for Clinical Research will be here. Also, Plexiderm and 904thin.com. We begin with the Jacksonville Center for Clinical Research. We are speaking today about memory problems and Alzheimer's disease. Sharon Smith, who is a nurse, and Dr. Booras, who is a family physician with Baptist Health, join us. And this is, we're talking about real clinical trials that, where you guys can pinpoint the problem of memory loss, dementia, and Alzheimer's disease. And this is a problem that it seems like it's on the rise. Welcome to Look Local.
Thanks.
Thank you.
Mm-hmm.
Thank you.
This is a concern for a lot of people and a very serious problem.
Yes, yes. And that's why we've really embraced it and started a free memory screening program for people over 50 who haven't even been diagnosed but are concerned about their memory. They can come in and call us for that. And we have several enrolling trials right now, 5 to 6 and more coming, that deal with mild to moderate Alzheimer's disease.
I'm going to ask you, okay, so when you say for people over 50, is that when it actually starts? That's the age group that you're looking for, or how?
No, unfortunately, sometimes the issues start when they're younger, as low as 30 or 40, but most of the studies are only for 50 and over. That would be a qualifying factor.
And so you say memory problems, and you give them a memory test.
Yes, yes. So they come in and they sit down with our memory screening nurse, and she goes over their complete medical history, their medication history, and then she does a verbal cognitive exam with them. Depending on the results of that, she can do another computerized exam, and a physician reviews all that material, takes it back to the person to say, is this age-appropriate memory loss, or is there something that we need to look into?
Okay, and Dr. Booras, thank you so much for coming in as well. So tell us, from your vantage point, you know, what goes on in these trials, and how serious of a problem is this that you're seeing?
Yeah, dementia is a serious problem, and Alzheimer's accounts for 70 to 80% of all cases of dementia. And I think it's important to define dementia. It's an impairment in your mental abilities severe enough to interfere with activities of daily living. That's probably the best way to define that.
Okay, and we have a lot of viewers that watch this show that are in that age range. Right. Some of them may have parents. Is this something that you would notice in a loved one? Is it something that someone picks up first, or does the person themselves who's having the memory loss notice that there's a problem?
Most of the time, it seems to be the family members who pick up on it initially. And, you know, Mom or Dad, you've told me the same stories over and over again. And there's other impairments above and beyond memory. There's impairments in judgment, impairments in even perception of distance and space and color, forgetting what the TV remote does, how to do activities you normally could do quite well. I saw one of my patients recently kind of forgot what the key was for.
Wow.
Got to the house, couldn't quite figure out what to do with the key.
Yikes.
And so those are things that frequently family members notice. And so many times we'll talk to the patient themselves and ask very specifically, are you having any problems with memory? And we'll get a no as the answer commonly. And the spouses or the children are telling me otherwise right along.
And let me ask you this then. Are the people that are actually having the memory problems, do they realize it and they're embarrassed? Or do they feel trapped within themselves? Or are they oblivious to it?
That's a good point. I think it varies from person to person. All of our trials do involve bringing somebody in with you who spends more than 10% of the week. And they do query both the person that you bring in as well as the patient. And it varies from patient to patient.
So there might be some patients that are experiencing memory loss that don't really have a problem with it, that are just kind of, they're in a happy state maybe. Yeah. But then there's other ones that may feel pent up or angry, or if they can't express themselves, or they maybe find it hard to? Is that how it
Very
works?
much. Dementia, Alzheimer's in particular, is also associated with some very significant behavioral changes quite a bit.
Okay,
I ran across one of my patients recently who 3 times in a row was the victim of scam artists, and they took quite a bit of money, which is, you know, your savings is going away just because somebody has found a way to come in and you don't have that judgment to pick up. This is a scam. I'm being taken advantage of.
They don't even realize they're getting ripped off. And someone is preying on the elderly. And we hear the stories like that. That's terrible.
It's terrible.
And, you know, being in Florida, we have these silver alerts. And there's so many older people that retire down here from other places. And ones that move here and just love it in a relief, I guess. But these silver alerts, so they get off and they can't be found, or they're driving somewhere aimlessly.
Had some patients end up Orlando, Daytona. The family they're panicked.
Yeah.
We have no idea where dad or grandpa or grandma.
So they're driving off in a car and they don't know. I guess they
can't find their way back.
Oh my. And so some of them they're gone for hours and sometimes even days. They can be. Okay, so this is a real serious problem, and it's a scary problem because nobody wants to think of anything happening with their minds. I mean, all kinds of diseases are bad, but Alzheimer's is something that is bad in a different kind of way, it seems to me.
Yeah, very much. That treasure trove of memories and recollections and relationships we developed over all those years can just go.
One of the things they say is that your recent memory goes first. Is that correct, and why would that be?
Remote memory is stored in different parts of the brain. Let's think of it in a way, it's written in stone. You're much more likely to remember things that might be 10, 20 years ago. I have one of my patients diagnosed with Alzheimer's that could recite some pretty elaborate poems at length that they remembered decades ago in their prior life as a teacher or whatever. But what did you have for dinner last night or breakfast this morning? What year is it? Date? Where are you? Those sort of things.
I had a grandmother who spoke Czechoslovakian a couple weeks before she passed. We'd never heard her speak it her whole life.
Wow.
Talk about remote memory. She learned it from her grandparents when she was little.
So it's the memory that you learn as a child, the memory that's been with you the longest, that stays the longest. Towards the end of Alzheimer's, it eventually gets to that. But it starts at the recent memory.
Yeah, I think a more recent memory is kind of more of a gelatinous state rather than written in stone. You know, it hasn't quite gelled yet, and it's more likely to be lost when the nerve fibers just aren't functioning properly.
Wow. Okay, let's talk about the clinical trials and what we can do in this, what we should do. We've got the information up on the screen now, so.
Well, there's a lot of reasons that people might want to be interested besides the scare of the Alzheimer's. A lot of people like to be involved in the trials because they get this cutting-edge treatment before it's ever brought to market.
Okay.
Some people want the legacy. They want to give back to medicine and medical research for their grandchildren and the next generations down the road.
I think that's fantastic.
They do.
So what should we do if we want to take part in the study? What should we be doing?
Give us a call or come to our website. We bring them in and we evaluate them and we find the perfect trial that will match their condition.
Okay, and where are you guys located? The Jacksonville Center for Clinical Research. Where is that?
We are actually, this office is located about 3 blocks south of Memorial Hospital and University, but we have 8 sites in Florida in total. We're the only site doing Alzheimer's and memory loss. We were started over 20 years ago by our cardiologist and CEO, Dr. Michael Koren, and Dr. Charlie Booras was one of our first physicians to ever come on board.
Well, it's wonderful to have you guys, and it's a great opportunity then for somebody to maybe get that testing done now and get medication that can at least maybe slow down the progress of the disease.
Yes.
That's definitely what we're looking for in the research protocols. They seem to be able to correct the underlying pathology that we feel is causing Alzheimer's.
Okay, and any final thoughts in the last 15 seconds? What do you really want to pass on now to the viewers?
I think the primary emphasis is dementia is not a normal part of aging. It is a disease. It is now felt to be treatable with new medications that help remove amyloid from the brain and other things that cause the loss of brain tissue. Diagnosing it early before brain tissue is lost is the key.
There you go, early diagnosis. Thank you both so much for coming in. We look forward to having you back on Look Local. Thank you.
Thank you.
Okay. Coming up next, Plexiderm. It's a way to make you look younger without needles or surgery, and it does work. We're going to put it to the test and show you. This Thursday, it's Starry Night at the Ritz. A holiday celebration starts at 7 p.m. It will be a family event and a very special night. For more information, you can log on to jaxevents.com.